Hi, my name is Aaron Gerds. I'm the editor-in-chief of Asheville News. Welcome to this month's From the Desk of. The start of President Trump's second term has brought significant uncertainty to the world of medicine, especially for those of us working in hematology. In his first 100 days back in office, the administration has moved swiftly to reshape the federal healthcare landscape through executive orders, rule changes, and emergency powers. On day one, President Trump withdrew the U.S. from the World Health Organization and eliminated all federal programs promoting diversity, equity, inclusion, and accessibility. In the weeks that followed, his administration canceled scientific grant review meetings, proposed deep cuts to indirect research funding for hospitals and universities, and laid off roughly 10,000 employees from the Department of Health and Human Services. These actions have sparked a strong backlash from the medical and scientific communities. Nearly 2,000 elected members of the National Academies publicly condemned the administration's approach, warning of a climate of censorship and fear. And the concern is real. In hematology, where advances depend on stable funding and sustained scientific collaboration, the ripple effects could be profound. Research into blood cancers, clotting disorders, and gene-based therapies risk being slowed or stalled. For this month's feature article, Ash Clinical News spoke with hematologists and researchers to find out how policy changes made in the first 100 days of the Trump administration are affecting the care of patients with blood diseases now and in the future. For something in a different vein, in patients with a history of stroke and persistently elevated clotting factor, particularly those with factor 8, 9, and 11, current guidelines suggest a careful evaluation for underlying prothrombotic risk. In this month's You Make the Call, Dr. Berube discusses testing and treatment recommendations for patients with elevated factor levels post-stroke. In this month's Editor Corner, Dr. Gagnat writes about her patient Shannon's journey through AML. It's also summer Congress season, and the July issue has all of our on-site coverage of this year's ASCO and EHA meetings. That's all we have for this month's From the Desk of. My name is Aaron Gerds, and until next time, keep the blood pumping.